Ever wished you could like actually see your own heart beating? Well,
Yeah.
today we're going to dive deep into
Like a
echocardiograms.
window to the heart.
We're going to unpack exactly what they are, how they work,
Yeah, exactly.
and why they're such a game changer when it comes to all things cardiology.
Absolutely. Echocardiograms have really revolutionized how we understand and treat heart conditions.
Oh, it's
Just so
incredible.
much.
Like I've always thought it's just absolutely mind-blowing that we can use sound waves to create these images for heart.
It's like a medical super.
It's like a superpower, yeah.
Yeah.
But before we get into all of that, can you give us like the real basic breakdown?
Sure.
Like what exactly is an echocardiogram?
So in an echocardiogram, think of it as like sonar for your heart.
Okay.
It uses high-frequency sound waves to create these moving pictures of your heart.
Okay.
And these sound waves, they're completely harmless.
Okay.
They're painless.
Gotcha.
And we use a device called a transducer, which is placed on your chest. And that emits those sound waves.
So it's kind of like how bats navigate in the dark.
They
Use
do.
echolocation.
That's a great analogy.
Right.
So the sound waves, they bounce off different structures,
Yeah.
the different parts of your heart,
Okay.
like the chambers, the valves, the blood that's flowing through, and then they return to the transducer,
Okay.
and those echoes are converted into images,
Right.
giving us that real-time view
So doctors can actually see
of your heart.
the valves opening and closing,
Exactly.
the blood flowing through the chambers.
That's right.
That's incredible.
Yeah.
Sometimes I get a little winded going up the stairs.
Mm-hmm.
And, I always wonder if it's my heart or just me being out of shape.
Yeah.
Could an echo tell me that?
Absolutely.
Really?
One of the key things an echo can reveal is the size and function of your heart chambers.
Okay.
And it shows how efficiently your heart is pumping blood.
So it could actually pinpoint
Yeah.
whether it's a heart issue.
Yeah. It could help determine if it's a heart issue or if it's something else.
Oh, that's reassuring to know.
Yeah,
But speaking of different types of echoes,
sure.
I've heard of something called a transesophageal echocardiogram,
Yes.
or T.
Yes.
What is that all about?
So a T, it's a little bit different.
Okay.
With the T, the transducer is actually guided down your esophagus.
Down your throat.
Yeah, down your esophagus, which is that tube connecting your mouth to your stomach.
Okay.
And the reason we do that is it allows us to get much clearer images of certain heart structures.
Okay. So it's getting a closer look.
Exactly.
But I imagine having a probe down your throat isn't exactly comfortable.
You're right, it can be a little uncomfortable.
Yeah.
But we do take steps to ensure the patient is relaxed
Okay.
and that the discomfort is temporary.
Okay.
And the information we gain from that is just invaluable.
Sure.
Now, there's also the stress echo,
Oh, yeah.
which is done while exercising
I
or
know.
after taking medication that kind of mimics the effects of exercise
Yeah.
on your heart.
Okay.
And then for expectant mothers, there's a fetal echocardiogram,
Oh, wow.
which examines the baby's heart in the womb.
So cool.
Yeah.
So many different ways to kind of peek inside the heart.
It's true.
But what kind of problems
Yeah.
do these echoes actually detect?
Yeah.
Is it just about the size, or can they see more than that?
Oh, they can reveal a lot more than that.
Okay.
For example, think of your heart valves.
Yeah.
They're like doors that control the blood flow.
Right.
And an echo can show us if they're leaking or if they're narrowed.
Oh, wow.
So for instance, a leaky valve,
Yeah.
it means that the blood's flowing backwards,
Oh,
making the heart work harder
okay.
to compensate for that.
It's like seeing the plumbing of the heart in action.
It is.
What about the heart muscle itself?
Yeah,
Can an echo tell us anything about its health?
definitely.
Oh.
We can measure the thickness of the heart muscle.
Oh, wow.
And if the echo shows a thickened heart muscle,
Yeah.
that's a red flag. That your heart is working too hard.
Okay.
And this could be due to high blood pressure, for example,
Gotcha.
which would need to be addressed.
Okay.
And of course, it can detect blood flow problems,
Wow.
like blockages
Okay.
in the arteries.
Okay, this is all very impressive. But I have to imagine there are some limitations to echocardiograms.
You're absolutely right.
Like, what can't they tell us?
So while echocardiograms are incredibly powerful,
Yeah.
they do have some limitations.
Okay.
For instance, they can't show us the inside of the coronary arteries,
Okay.
which are the blood vessels that supply blood to the heart muscle itself.
Gotcha.
So to visualize those, we need to use a different test called an angiogram.
So it's kind of like having a puzzle, and the echo gives us most of the pieces, but not all of them.
Exactly.
Oh.
But even with those limitations,
Yeah.
the information we get from an echo is often enough to make a diagnosis and to come up with a treatment plan.
Wow.
And in some cases, it can even help guide surgeons during procedures So imagine a surgeon being able to see the heart beating in real time
Yeah.
while performing a complex procedure.
That's incredible.
It is amazing technology.
It truly is a window to the heart.
It is.
And knowing all of this that we've talked about today about echocardiograms,
Yeah.
it really raises an important question.
Absolutely.
How might this information influence your decisions about your own heart health?
Mm-hmm.
Maybe it'll make you a little bit more proactive about getting checkups
Yeah,
or encourage you to ask your doctor about whether or not an echo might be right for you.
absolutely. Knowledge is power.
Knowledge is power. That's
Yeah.
right.
You've been listening to the Learning Podcast, a production of metaNESTA. Remember, learning is a journey, one step, one insight, one skill at a time. We'll see you next time. Keep learning, stay curious, and as always, be awesome.